And this is her skin when we started the program, October 2018. And several months later, her skin, you can see it healed. But she had it not just on her face, on her body as well. At one point, she told us she couldn't even take a shower because her skin was hurting so much. What else is happening is it causes negative inflammation in the body because it spreads systemically through your body, and the immune system is responding as if you have a cold or a virus, as if something's attacking you. So that's why people may develop bleeding that leads to malabsorption, or it leads to immune response. They get food intolerances, and ultimately chronic health problems, all because of having this diet that's chronically destroying our gut lining and highly inflammatory. So that's why people are suffering from sinus issues, skin issues, joint pain, IBS. For some of you may have started with some of these symptoms, just like in my case, it started with my skin and hair loss and gut problems and headaches. So when you start having these symptoms, that's your body sending you a signal that something is internally wrong that requires your attention. But luckily, I was able to heal my health problems before getting any official diagnosis for anything. So this just shows you how powerful nutrition is helping you reversing the symptoms, where some people don't even have to wait to get a diagnosis, but to learn what they have to do with their nutrition to repair their bodies. So the healthy bacteria gets destroyed, and it has an effect on leaky gut. So what this means is the gut lining is getting destroyed, and these gaps between our cells are start opening up. So our cells in our digestive system, in our stomach, are supposed to be tightly close together. But when you have inflammation, then these cells start having these gaps between them. And when you have these big gaps between your cells, the things that are outside in your gut, they get into your bloodstream. Things that are not supposed to be in your bloodstream. And in here, we also have our immune system. So our immune system is seeing big proteins that it's not supposed to be seen, and it starts creating antibodies against it. So in our previous class, we talked about how a lot of those proteins, when you have leaky gut and your immune system is seeing them, then they look a lot like the protein in other parts of our tissues. So it starts creating antibodies against our own tissues as well. So that's why this leaky gut, that's what it's called. It's called permeability, because all the things that are not supposed to be in your bloodstream are leaking into your bloodstream and creating inflammation. So Crohn's and diarrhea, when people have inflammation in the gut, such as case of Crohn's or colitis, it can stop once we feed the good bacteria properly, and we also feed ourselves properly. And chronic inflammation, that's what triggers our genes for disease. So it is true that genetics will determine how sensitive you are to getting sick. But if you eat food that causes chronic inflammation, then you have this chronic inflammation that builds up over time that triggers our genes for disease, whatever those genes are for you. So if there's a damage in blood vessels, there's also inflammation in the blood vessels. So the blood vessels, they carry blood into the body. So the body, it tries to lay out these plaques to try to repair the inflammation. And you've heard of this term, atherosclerosis, and children as young as 5 years old are now getting these plaques in their arteries. So this is what leads to heart attack and strokes. So you might have to ask yourself how many maybe relatives or friends that you know who have suffered from some kind of cardiovascular health problem. That's because there is inflammation in the blood vessels that leads to these serious problems later in life. It increases the conversion of all of these products. So it increases the activity of COX-1, it increases activity of COX-2 and 5-LOX. And we have actually studied in our research how there's an increase in COX-1 when people have cancer cells. So we're using in our research medicine to try to block COX-1 so the cancer activity goes down. But you can see why do we have too much of this in the first. So what's happening is when you have too much of this, it also increases these products at the end. You can see here LTB4, prostaglandin A2, all of these products getting increased. So when you have too much of COX-1 in yellow here, which is responsible for blood clots, and that increases your risk of heart attack or strokes. And if you have too much of COX-2 in green here, this is responsible for blood supply, in which cells need a lot of blood supply. Again, cancer cells need a lot of blood supply. So it's feeding more blood supply to go to cancer cells and feed them. In addition, it leads to more inflammation, atherosclerosis, like we talked about in the previous class, joint destruction, destruction of healthy tissue. And the reason why the doctor haven't told you about it is because they learn which medicine you need to take to decrease the activity of this product. So for example, you can take aspirin to decrease COX-1. You can take curcumin, which is turmeric, to decrease COX-2. You can drink green tea. This is what you see here in red here. These are some things you can take to try to decrease this. And of course, there's lots of medicine for that as well. But when you have, all of this is coming again from the food. You want to start feeding the inflammation, which allows your body to heal. And if you have too much of 5-LOX, because let's say you had eggs or meat for breakfast, which is, a lot of people eat eggs for breakfast, then you have an increase in cancer growth, invasion, and metastasis, which means you have more chronic inflammation, asthma, again, swelling. So all of these, you can see all of these is responsible for inflammation. So when you hit your leg, let's say you go for a run and you fall, and it creates inflammation because your immune system, it comes in to try to repair the damage. But with chronic inflammation, you have too much of these products and you start to destroy healthy tissues. And that's how people start getting asthma, RA, edema, and swelling, because healthy tissues are not getting destroyed. So this is a client who had stage 5 kidney disease, and her kidney failure happened very rapidly. In fact, she's in her early 20s, and she was diagnosed with lupus nephritis. So lupus is an autoimmune disease, and it can attack different organs in the body. So in her case, lupus attacked her kidneys, and it started destroying her kidneys. And just within a few years, her kidneys failed. She had to be on dialysis. And the only thing we did is we changed her nutrition. And within 7 days, her kidney function, you can see kidney function GFR went from 5 to 10%. So it went up to basically doubled in just 7 days. And also her creatine levels extremely high, which is, that's why she had to be on dialysis, because she had really a lot of damage to her kidneys. And her creatine levels, really high levels, very dangerous levels, 11 went down to 5. And her kidneys continued improving after that. But this is the labs she sent to us because she was in dialysis. They were measuring her lab work frequently to see how her kidneys were doing. But the only thing we changed was her nutrition. She didn't change any of her medication. She didn't change anything else that she was doing besides her diet. So you can see, even while she was on medication, she was still having kidney failure. And that's how nutrition can help even your medicine be more effective. And let's talk about some other cases. So this is a client who had Hashimoto's disease. And in fact, he was doing celery juice. You probably could have heard medical medium protocol. Obviously, those coaches are not, they don't know how to use nutrition to reverse autoimmune disease, but yet they're giving somebody who has autoimmune disease nutritional advice. So his antibodies actually went up doing that diet. So here you go, his antibodies went up from 3,000 to 3,007. And then in a program, they dropped in 5 weeks by more than 1,000 points. And in addition to that, his TSH levels, he had very high TSH levels because, again, Hashimoto's, it destroys his thyroid. So he had low thyroid function. And because his TSH levels improved, his thyroid function improved because inflammation dropped so rapidly, which allowed his thyroid to start healing again. Here's another case, again, Hashimoto's. We do have a lot of clients who come to us with Hashimoto's, but this client also had gastritis and Hodgkin's lymphoma. She had stage 5 Hodgkin lymphoma. She was going through chemotherapy for her cancer disease, and she came to us for her autoimmune condition, and her antibodies dropped as well for inflammation. And in fact, she was feeling really great, even though she was going through chemotherapy. Her body was stronger and healthier to do the chemotherapy. And another client, what about gut issues? A lot of people struggle with gut issues. So this is a client who came to us. She had bladder inflammation. And there, again, the reason why I'm sharing with you this information is to inspire you, so you can see other people who have gone through this journey, they were able to get better, because it does give people a lot of inspiration and motivation to continue. So she had bladder inflammation, and her doctors misdiagnosed her for 2-3 years. They thought she had UTIs. But as you know, if you have UTIs and you take antibiotics, the UTI go away. But she had a lot of bladder pain to the point that she couldn't work. It really affected her with her job, and she had her own business, and she couldn't work on it because she was sick, and she was getting a lot of flu infections and laryngitis. So she would get sick for months at a time every year. So she also had gut dysbiosis and infections, and the calprotectin levels are high when you have inflammation in your gut. So some people, it will be elevated, and you can see her inflammation marker, calprotectin levels was 362, went down to 16. This is a 30-day. She actually measured her blood work just before we started, and then 30 days later. And in addition to that, you can see her inflammation was high. The calprotectin went down from 10 down to 4. Dysbiosis, her bacteria was imbalanced, also improved, and infections improved as well. So you can see how your gut can heal with nutrition. Again, all we do is nutrition. This is another client. She had positive ANA, and her ANA was positive. This is June 2019, and then she started a program. Don't remember exactly when this was taken, but she retested her blood work. I think this was after the program. Next year, because she started a program in 2020, and her ANA became negative. Among other improvements, first time it became negative. And let's talk about long-term progress, right? What happens to you when you continue implementing what you're learning in this program? This is a client who had Hashimoto's, lupus, hair loss, and she also had some eczema, skin issues, I remember, and joint pain. She had Epstein-Barr virus, elevated infections in her blood work. And you can see her thyroid antibodies, her autoimmune marker, continued going down. So June 2020, 41, and then it goes down 28, and then it goes down to 18 over time, because she continued implementing what she was learning in this program. But in addition to that, she was already feeling better by then. So let's just, that's another case. Let's skip through another case. The client had positive ANA 2017, 2018, 2019. And 2019, when she started a program, her ANA became negative in 8 weeks in this program. And in fact, she got so many different diagnoses. Doctor said she had Crohn's, doctor said she had colitis. They told her she had arthritis, just multiple autoimmune diseases, PCOS. And this client actually, I believe she's 39, and her goal was she couldn't get pregnant, and she got pregnant this year. She's still doing well. We worked with her in 2019. And in fact, we became very good friends since we helped her with her symptoms. All her symptoms were gone, and they have stayed gone. And this is just what she shared because she was really excited about her lab work improving. Let's talk about the skin. So your skin, it's the last organ to receive nutrition and hydration. We had some clients who had eczema, dermatitis, psoriasis, and that was able to clear up in 6 weeks. Some clients, it took a few months for their skin to heal. So this is a client who had lupus. Doctors diagnosed her with skin lupus. They don't really know what triggered it, but she did have Hashimoto's for years prior to that, and alopecia. And this is her skin when we started the program, October 2018, and several months later, her skin, you can see it healed, but she had it not just on her face, on her body as well. At one point, she told us she couldn't even take a shower because her skin was hurting so much. Her body was burning because how fast her immune system attacked her skin. You can see her skin was able to start healing. Almost all of this is gone. You can hardly even see it on her face. And we also became very good friends with this client. She still stays in touch with us. She's doing well.